My father's influence of the dermatology department at IU revolved around really his mentorship and his teaching for medical students, residents, and colleagues throughout his career, but also for being such a giant in the field. He was very approachable and always had the time necessary to spend with those around him to really help guide them to be what they want to be.
The primary trait that I think of Stephen is as an educator. He loved to teach. I think secondarily, he was a mentor. He felt very dedicated to our residents and particularly the medical students. He would share his expertise with anybody, and that was Stephen Wolverton.
I first learned about Dr. Wolverton when I was a first-year resident, when we used his drugs and dermatology textbook.
Steve was so knowledgeable, and one of the gifts and talents he had was writing books. And his first book in dermatology was called The Comprehensive Dermatologic Drug Therapy. First book was in 2001, and then 2007, 13, and 21, and he would still be writing a revision today because it's so impactful and he loved doing it.
Stephen Wolverton is probably our most prominent figure within the Department of Dermatology, extremely well known for all the dozens of residents he's trained and many medical students he's helped mentor, junior faculty he's helped mentor, and he's just very well known for taking excellent care of his patients and advancing the specialty in terms of drugs and dermatology.
The value of grand rounds for residents and trainees really revolves around a few different things. One is you get to interact on a more personal level with outside speakers who come to present their topics of expertise and the groundbreaking advances in the field. But also it's a great way to learn from interesting patients who are presented at grand rounds, really learning the basics of dermatology, but also navigating the complexities of more challenging patients.
Stephen was very committed to grand rounds. It was part of the teaching that he wanted to do. And one of the things that I discussed as chair, is that during the wonderful years that he and I were in the department, he would lead grand rounds.
There's never a dull moment in grand rounds led by Dr. Wolverton. He's very engaging. He would have a way to get everyone in the crowd involved. It was a free space, an open space, a safe space. Everyone could ask questions and really just truly interact. It's hard to think about grand rounds and not think about Dr. Wolverton.
Practical needs of what we aim to achieve for the Stephen Wolverton Grand Rounds Lectureship Series is really to fund 4 or more lectures throughout each academic year where we can carry on his tradition and invite in 4 or more outside speakers who can present on their area of expertise.
Beyond our own department, we welcome dermatologists from the community into Grand Rounds, so it really touches the entire state, the entire field of dermatology by expanding Grand Rounds, and it helps us be better dermatologists.
To have this be the Stephen Wolverton Grand Rounds is an honor that I'm sure he would really have enjoyed.
Grand Rounds, establishing his name is wonderful. He did those things himself, and he wants that carried on. It's so important to people to share their knowledge and to make it understandable, because at the center of it all, it's the patients. And this is what helps make all that happen.